Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gwen Vaughn.
Yeah. Welcome to the Auburn Medical Group. Where are we? Live stream. I've got the Dutch in my mouth. And anyway, welcome. This is Dr. Mark Vaughn.
Hey, I'm Dr. Gwen Vaughn. Get it out.
What are we talking about?
What are we talking about?
What are we talking about this fine evening?
I think we're talking
Laura Webb,
about
what are we talking about?
GLP-1s.
GLP-1
But
agonists.
not just specifically those. But
Not just that, but yeah, that's kind of what it came from.
yeah.
I was at a lovely party this weekend where somebody said, hey, what's the deal with?
Hey,
And
that's how
so,
all of our great ideas come up.
Yeah, so the question was, what's the deal with these GLP-1s, I believe is kind of a common parlance for
term,
what
yeah.
we would call a GLP-1 agonist medicine,
Yep.
or GLP-1 receptor agonist.
Right.
Those medicines like Ozempic, Wegovy,
Manjaro, Zepbound.
Zepbound. The ones
Measles.
that people are losing, that's another one, or that's the generic name for some of those. Those medicines that people are losing lots of weight with right now that are all the rage. Started as diabetes medicine, found to have benefits for the heart, found to have benefits for the kidney, found to help people with addictions.
Yeah. All sorts of things.
And even some other psychiatric diagnoses, they're finding to be helpful for that. And then on the bad side, thyroid cancer, pancreas cancer, pancreatitis, these cases of blindness that they're not sure what the connection is, very, very rare, but enough that people are starting to investigate, hey, what's going on here, that people are having loss of vision when they're taking these medicines. One of them was bilateral.
Oh, I didn't hear about that one.
So the ophthalmologists are starting to look into that. But that is a very, very, very rare
I would think so.
occurrence, as are things like cancers or pancreatitis.
Mm-hmm.
I don't know if that's a more common thing.
I haven't ran into it yet. I mean, the GI side effects are what I run into commonly. Nausea, vomiting, diarrhea, abdominal
Things that
pain.
make you not feel like eating.
Yeah.
It works.
Yeah.
I don't feel like eating when I'm throwing up.
Strangely, I'm losing weight.
But although we do see that, we do see the loss of appetite, sometimes nausea, sometimes vomiting.
Yeah.
Sometimes people have to stop these medicines because of it. These are, if you're not already up to date, they're very expensive. They're $1,000 a month if you don't have some kind of insurance or some kind of a card that the manufacturer gives you to get a discount.
I've had a few patients where their insurance has covered it, and they've gotten it for fairly cheap.
It is happening.
On occasion, we get it like $40 a month, or like.
So we do see people taking them
like
because
that.
of them.
Yeah, and those who I have given it to have experienced success on it. One of my patients, he called it a wonder drug. Those were his exact words. He's like, "This is a wonder drug. It truly is amazing how it's working."
Yeah.
Multiple patients doing well. Now, for a while there, access was a problem. I had one patient.
There was a period,
especially with Ozempic, just because it was in the media. It was the word everybody was coming to their doctors with, so it was prescribed a lot. So I had one patient who had to go to like San Francisco or something. He was like just calling all around just to get that next dose, but he was so committed to it, and he had lost a lot of weight. He really enjoyed how it was helping him. So
there's actually a little bit of a reason to make sure you don't run out.
Yeah, right. Because if you restart at those higher doses, there's a reason we kind of taper up. If you stop, have a little window where it kind of gets out of your system, and then you start up at the higher dose.
Just a week.
GI symptoms are very common. I have seen it multiple times, unfortunately.
Don't have a break between.
Don't do that. Yes. Don't try to push out to extend your prescription, because you may run into that.
I really should give some attention to our many viewers here.
Yes, thank you for
including Laura Webb and Bianca.
Good evening.
and
evening.
Laura Webb and Bianca.
Well
they're
done.
having a conversation among themselves.
Okay.
That's nice. I'm glad you have each other.
Mine are free on the NHS, so the NHS pays for it. Okay.
Oh, buy it through a doctor. It's £100 a month here.
Buy it through a doctor.
Buy it through.
That may be what we're talking about.
Yeah, we may have something to say about that.
Yeah.
So the question was, the impression that he had was that because of the demand, there was some kind of a relaxation or a sharing of the formula of the patent, licensing of the patent, so that other people could make GLP-1 agonists.
Sure.
Well, that's not what it was.
It's kind of a half truth there.
Yeah, they're not using the actual
Straight from the farm.
Rybelsus.
The semaglutide
it is
name
possible
brand is
that there are other GLP-1 agonist chemicals, molecules that people have synthesized, but they're not the ones that have been tested and approved by the FDA. And they may work, and who knows, they may even be safer. Or they may be more dangerous.
Well,
complete unknown. It's a wild west.
So what we're talking about is like those compound pharmacies, some of those online pharmacies, and when semaglutide specifically, which is Ozempic, was in a shortage, that actually allowed compound pharmacies to start using it. There is law that allows compound pharmacies to produce that type of medication if there is I don't know, what would you call it? A scarcity? If it's not, you can't get enough. Or the other way that they're able to get around this is if there is something in it that people may have an allergic reaction to. Like somebody's allergic to peanuts, they can't have peanut oil. It was created in peanut oil, something like that. So they need to compound it. Now this is some weird example, but they have to give a compounded type of it. And that allows compound pharmacies to make it separately outside of the name brand. But is that what's happening?
Officially, that is not what was, when it's compound. Once it's compounded, it is officially not the same thing that was in the studies.
Yes.
It may be, and we may have very little concern for it to be either dangerous or not effective. Those are the two things, either dangerous or not effective.
At best.
But if it wasn't exactly like that in the studies that the FDA reviewed, then it's not
we don't have the
what
data.
they approved.
Right.
So that's where compounding pharmacies are always kind of on the edge of legit.
Yes. Yeah. Did they compound it in some diluent, which is something they dilute it with, that made it inactive? Did they do the studies to check that out?
Why is it I'm thinking of toilet wine?
What are you
prison wine? Why is that what comes to my head?
Because I said diluent.
Oh, okay, yeah. I don't know.
But yeah, is there something that they add to it or that they make it with that was not studied? There's a lot of unknowns that
the prisoners say they're compounding.
I'm compounding. It's my compound pharmacy.
I'm sorry. You were talking about a serious subject, and I go and do that. I'm sorry.
So you've probably heard of some of these online, like if you just Google it right now, don't stay on this, wait until our show's done, then go do it. But if you go and Google just like GLP-1s or semaglutide or anything like that, like the top ones that come up on Google are sponsored ads from multiple pharmacies or video, what do we call it, like telemedicine appointments where you can get your GLP-1.
And telemedicine can be done with a real doctor talking to you and assessing and asking if you have a family history of thyroid cancer,
that should be done.
Cancer, or
absolutely be done.
Yeah, the vision problems, vision changes, keep you alert for that. So it is a real doctor somewhere. They'll give you a prescription, and usually, when it's a real doctor, usually it's a prescription intended to go to a pharmacy and can go to any pharmacy. If it can't go to any pharmacy, that should make you wonder what's going on here.
Why are you sending to this specific pharmacy?
Why can't I get this medicine at a regular pharmacy?
CVS,
where a pharmacist looks at the prescription and makes sure everything's on the up and up. You should wonder that if that's the case.
Should at least send a flag, yeah.
But I think most of the ones I was looking at, they're actually real doctors that would probably just send it to a real pharmacy, and that's where you discover how much the real stuff costs. Now, for the stuff going to a compounding pharmacy, so I was following that trail this afternoon when I came across. Yeah. I gotta look. I think it's Remedy Drugs. Do you remember?
Remedy.
I think it was Remedy Drugs that I found. I will look at the official. I'll show you. I will look at the official Board of Pharmacy of the State of California accusation.
Oh man.
Against Glencoe Med Incorporated doing business as Remedy Drugs. So this is the action taken by the California State Board of Pharmacy against Remedy Drugs, where they pulled their license. I think they still exist in other states. But that was one of the pharmacies I came across and looking at who's doing this? What is this that I was asked about at the party this weekend? And well, Remedy Drugs was one of them. And it didn't specifically say anything about GLP-1 agonists in the documentation from the Board of Pharmacy. It was about other legit drugs that we prescribe, specifically medicines that you tend to use in older patients. So I think the complaint was actually through some kind of a contractor for Medicare that looks for fraud.
Could be.
And what they got them for was that they were selling more units of certain medicines. I remember Restasis and Zetia were a couple of them.
Common medications.
But they're selling more units than they were purchasing to bring in over some period of time.
It sounds like pretty clear fraud right there.
And that's the magic of compounding.
It's amazing.
You can put out more and sell it as if it's the real thing than you brought in.
Diluted to a certain,
Still think of the wine and the... So, yeah. Yeah, when you think of compounding pharmacies, think of the guys in the prison making the wine in the toilet.
Okay. I'm trying to think.
I don't know why.
Think of the last time you used a compound pharmacy? Would you have to send in anything?
Last time I used a compounding pharmacy probably would have been...
Low-dose naltrexone is probably the one that I did last.
Probably would have been something in triamcinolone.
Oh.
Lidocaine and triamcinolone? Maybe lidocaine and Benadryl and triamcinolone?
They used to do the magic mouthwash and stuff.
Yeah, oral stuff.
Calm down.
For putting on like canker sores.
Yep.
Don't do a whole lot of it.
Yeah, we don't use all of that anymore.
I'm sorry, I'm being a little too hard on them. Like Dr. Gawain said, there is a place for compounding, but it's
we don't use them that often.
It is just not.
Right. They should and by law are required to have quality control processes. But still, I mean, it's one of those things where
the studies weren't done on.
Yep.
Whatever comes out the
You're
other.
absolutely right.
They're also popular with the so-called bioidentical hormones.
Bioidenticals.
Again, if it's bioidentical and it has the activity that you're trying to get from it, then why would you think it's safer when it hasn't been tested to see if it's safer?
Yeah.
Why would you automatically assume
because it's bioidentical,
as effective but not as dangerous?
That's a big assumption.
If the study's not done to show it's effective, it's also not done to show what side effects or adverse effects it has. Mm-hmm. There you go. All right, let's get back to our comments and questions. Cindy Bond. Hi, Cindy. Are GLP-1 safe to use, lose weight? I have an appointment early April to come to talk about this. If you call it a procedure, insurance will most likely cover it. I'm seeing the NP at your office.
At our office.
And
excellent.
Dr. Vaughn, is it best to see you on this or the NP that I have an appointment with? NP's great. They are very knowledgeable on this. I would not say that these newer things like this that I would be necessarily any more knowledgeable about unless I just did a show on it, maybe.
I would say that,
but that would have nothing to do with the regular
GLP-1s are
prescribing
just
for it.
such a common discussion that we have with our patients. That
And it's not a procedure. It's a medication that you inject yourself
visit
at home.
The discussion's a regular visit. It's not a procedure. The medication is a prescription that we send.
Yeah.
to a
As far
pharmacy.
as the safety of them, they're like we said. If you have a family history of thyroid cancer or pancreatic cancer, you yourself have pancreatitis, don't use it. If you haven't had those things, be prepared that you could have some nausea.
Side effects, GI side effects.
The people who have it really bad will even be throwing up with it. There can be diarrhea. We say all that because we want to cover all the bases. Understand that we are regularly still prescribing these medicines and seeing good results with them. So I don't want people to be scared of, if they have tried all these other ways to lose weight, and losing weight is important, or they have diabetes associated with the being overweight, it's okay to think about it and to talk about it and to try it.
Yeah. It's a regular thing that I bring up. Yeah,
I don't like how expensive. I'll say that again. I don't like how much money is being spent on it.
Absolutely, the biggest hurdle there for many people. And Medicare, unless you have diabetes, won't even cover these. So you can't just be overweight.
Well, it's not Medicare. It's
Part
D plan.
Yeah, Part D plans. They won't cover it. If you're just trying to lose weight, you need to have another diagnosis along with it. So. Yeah.
And Cindy says she summed it all up. I just want better health.
We want better health for you.
Yes,
absolutely.
Yes. Used correctly with the right screening, GLP-1s do contribute to better health at $1,000 a month. That either the patient is paying or the patient's paying part of, or the insurance is paying, which you're paying for through your premiums, as is everybody else.
Yep.
Just like any insurance.
Yep.
If everybody's making claims,
if more and more people
your house burning down, or
and if more and more people are doing that, insurance premiums are going to go up. This is just part of that, part of the reality of our medical financial system.
Okay.
Yeah.
So I hope, John, I hope we answered your question for you there.
Hopefully.
Yeah.
I didn't know there was a question. I wasn't there. But.
Yeah. So I think it was that he had heard of GLP-1 agonists that aren't the ones that are approved.
Right.
But are being used through the compounding pharmacies.
Yeah.
And no, that's not supposed to happen. That's sketchy. They may be as good. They may be as safe.
Yep.
But they haven't been run through the process.
Mm-hmm.
Or worse, they started down the road of the process and didn't go through the whole FDA thing because they saw that it wasn't going to pass.
Yeah.
That's the other part of it. What don't we know on that on some? And I have very, very little knowledge. I just know that it exists, that there are these other GLP-1 agonists.
So, I was reading some of the names.
Come out.
I was like, I've never heard of that one before. That's a new one.
Yeah.
Some new names that we haven't heard of.
And a lot of the things, when I was looking at, what are these? I looked at this one called HIMS.
Yeah.
And it's all those things that people will pay money for.
That they do.
That the insurance doesn't always cover.
Yeah.
But they want for, I hate to say this in the
Vitality.
same conversation we just had because of the real medical benefit of the GLP-1 HIMS. But I'm going to say, vain sort of vanity kind of things. So men's sexual enhancement type.
Yep.
Which
testosterone.
Somehow they think testosterone is the thing to use for that.
Yeah. Right.
And then the GLP-1s fall under that, and then probably, limiting hair loss would be. I'm just guessing that's what one of them is. Yep. So they appeal to a certain aspect of
sketchy
on the periphery of what health is.
Of health,
but you can find doctors who are just as content to get paid for using their license to write for that kind of thing. That's what it looked like the website. What are you coming here for? Are you coming here for lose weight? Are you coming here to add girth? Are you coming here to, whatever the thing is that you're going to that website for? And a doctor will have a consultation with you. So they're supposed to be licensed in the state you're in.
Should be.
And they'll give you a prescription, and they should go over the dangers, like for example, testosterone, which you're going to have to some way of injecting it. A lot of patients do it themselves.
And you should do labs to make sure that your testosterone is low on 2 separate occasions if you're following.
I saw that they do actually talk about having to go and get labs drawn.
Okay.
Although that was a little curious.
Which lab do you use?
Yeah, I don't think you could use just any lab on that. On one of them. There was something about which lab can you use for what tests. We'll send you a kit for some things. I don't know how you send a kit for blood draws. I was a little confused. I didn't read the whole thing. You can tell I kind of don't like those. It's, I guess, because it's. You know what I think? I think it's because I imagine. Oh man, I'd probably get paid as much as I do for what I'm doing here, and all I'd have to do is over the phone just give people what they want. Just here's a prescription for testosterone. Here's a prescription for Ozempic. Yeah. Without any qualms about maybe there's other things we should be looking for that are affecting their health.
Yeah.
Why
are you lethargic? It's got to be testosterone. I mean, we probably shouldn't look at other things.
In case you haven't watched our shows on testosterone, you need to know testosterone is not a wonderful thing. It's
got risks.
There's reasons it can only be given in certain forms in the United States, and it has to do with cancers. Liver and prostate cancer. This isn't the testosterone show, but that's Joe Rogan.
I think that's right. We don't get that kind of money either. Tell your friends. Maybe we'll eventually do it. So as a family practice doctor, where I am having these long-term relationships with my patients, following them over years. Probably the biggest thing that gets me with these is that is a break in the care. That is one more thing that you're not coming to see your doctor, who probably knows your medical health better than anything and knows those things about your family history and your past medical history that may be important to know when you're prescribing some of these things. So it is that's what concerns me a bit, a lot.
What stone might go unturned?
Yeah. I mean, I understand why people do it, because insurance sometimes just doesn't cover it, and it is extremely expensive.
And it's wonderful to get paid cash instead of submitting a bill to the insurance and then having it denied, even though you did it.
Yes. Yeah.
Yeah. Blue Cross is horrible for that.
Mm-hmm. Yep. Yeah. So, anyways.
So, it does kind of sting that. Yeah, sometimes that's doctors. Our patients that are going and doing that one.
I've had a few.
We would have checked that out if it's a problem. We would check it out. I mean, it's not that we don't prescribe. I can think of one patient in particular. I do prescribe testosterone, and it's actually appropriate in his situation.
Me too. Yeah.
But not for the wrong reasons. People imagine what it's going to do because of where testosterone is produced and other effects of it. So let's see here. Other comments or questions coming through. And we never saw Lindsay Entwine today, so that's a little disappointing because she is one to be honored because of her Patreon activity. Okay, we should probably at least let people know that they also can participate in Patreon in case they wanted to. Anything else? Anything really cool?
Anything really cool?
Measles continues to spread. Now, was it an adult that died?
300 cases now? Is that what it is? It's getting up there.
Becoming more of an issue in New Mexico.
Yeah.
And then there's the list goes on and on about other patients. States that have little, like three or less cases. Thankfully, California is still on the low end.
Every news article I read on it, it's just one step closer to like a full-on measles outbreak. So it makes me
not going down yet.
Worried for unvaccinated people.
Yeah. Oh, we should address the vitamin A thing. We should do that.
Okay.
So vitamin A, in developing countries, they found that in people who did not have good nutrition, if you gave them a couple doses of vitamin A while you're treating them with their measles infection, that they did better. Mm-hmm. I don't know that's ever found to be the case in the United States. They do recommend giving 2 days of vitamin A if somebody is infected with measles in the United States. That's all you need to replenish your body's stores of vitamin A. You don't have to get it every day.
Yeah.
In this country, we have very little, if any, need for supplemental vitamin A, except for the people who are protecting their eyes and the AREDs and that sort of thing.
Yes. very specific.
So
occurrences.
the concept of I'm not going to vaccinate my child, I'll just give them vitamin A if they get measles is not
No.
nowhere near the safest path for your child.
Yeah.
Right. Okay, I had to get that out.
All right,
thank you.
There you go.
And Laura Webb thinks that is what she thinks. She thinks it's scary.
A measles epidemic? Yeah, that is scary.
Yeah, when you know what life was like in the 50s and 60s.
Yeah, before we had a vaccine.
Yeah. It was. There's a lot of kids that didn't grow up.
Yeah.
But
And
that was mostly before even my age, so that's not something I really.
Right.
I remember seeing one case in residency.
Oh, okay.
Yeah, I said, hey, come here and look at this. There's complex spots.
Right. I've never seen any. Never seen measles. It's a textbook diagnosis for me.
All right, so we'll finish with that. I don't know for sure if we will have a show next Monday.
Okay.
Not 100% confident
All right.
about if that's happening, but you'll be okay because we'll be back after that. Okay, and then Cindy also wants to get an adult MMR shot. Yeah, if you haven't had it.
Yeah.
Or if you have had it, we might recommend just checking a titer.
Anybody born before 1957, it's assumed that you have immunity. If you do want to check a titer, it's probably appropriate.
And then 57 to 60. If they're given the vaccine before, is it 67 or 68?
Yeah, I'd have to look that up.
That one we're repeating.
Yeah.
Yeah. So if you were like 5 years old in 67 or 68, somewhere around there. We'll probably look it up in a book if you're close to it.
Double check.
Yes. All right. Until next time.
Yep. I'm Dr. Wayne Vaughn.
Dr. Mark Vaughn telling you to stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.